One of the most controversial topic or questions I get as a nurse in my DM is the difference between nursing in the university and nursing in the federal, state, or missionary schools of nursing. In this video, I will be talking about the difference between nursing in these institutions, their mode of admission, their individual lifestyle, their certification, and job options. Hello everyone, welcome back to my channel. My name is No Sunshine. If you are a returning subscriber, thank you so much for coming back. But if today is your first time, please subscribe and turn on your notification bell so you could get notifications for my uploads. A university nurse refers to nurses who study and graduate in a department of nursing in the university, while a school of nursing nurse is a nurse who graduates in either a federal, state, or missionary schools of nursing in Nigeria. In the university, to get an admission, you have to go through the normal stress and tussle of getting a university admission. You need to pick up a JAM form, you need to write up to tests. You also need to meet up the established or proposed cutoff mark. You need to then secure an admission, and then boom, you can start schooling, pay acceptance fee, pay the stipulated school fee, and get your admission. While in the schools of nursing, you have to go to that particular school of nursing, pick up an admission form, write their entrance examination, meet up their stipulated mark, and get admission. Then you start PTS. But the new guideline now is that most schools of nursing are going through the JAM route. So you really need to check up any schools of nursing you're interested in so you could see what is your criteria for admission. I wouldn't want to compare life in the university to life in the schools of nursing. Life in the university is just a normal university lifestyle. It's more freer. It's also very strict, actually. While in the schools of nursing, life is, some people will refer to it as an upgraded secondary school. There are certain things that will be done in the schools of nursing that can never be done in the university, because of course university is kind of more matured and more freer than the schools of nursing. In the university, postings, or what we know as clinical experience, starts in year 2. Okay, while in the schools of nursing it starts in year 1. But the nursing students in year 2 in the university and in year 1 in the schools of nursing who goes for clinical is not expected to touch the patient. He or she is supposed to just observe while the senior student and the staffs work on the patient. He's supposed to observe and learn. In the university, you wouldn't have to wear a stipulated uniform. When I was in year 2 in my university, a uniform stuff came up sometime, but it was refuted and it stopped. So most universities don't actually wear uniform, but in schools of nursing, it's compulsory. You have to wear uniform most times. You go to clinicals, you go for a lecture with all of it. But in the university, we wear mufti, but wear the nursing uniform when we're going to a clinical experience. The number of years in the university is longer than the number of years in the schools of nursing. We have 5 years in the university, excluding your 1-year internship and your 1-year NYSC certificate, making it 7 years, while in the schools of nursing, of course, it's just 3 years. The university nurse actually graduates with a lot of certifications. Of course, it's a BSC program. So the nurse graduates with a Master's of Nursing certificate called BSc Nursing, an RN, a registered nurse certificate, an RM certificate, and an RPHN certificate, which is also known as registered public health nurse. Also, he or she might also graduate with a BLS and a ACLS certificate, depending on the department's arrangement. While for the schools of nursing, the nurse graduates with just an RN and an RM certificate. He or she might also graduate with a BLS certificate and an ACLS certificate, depending on the arrangement in the schools of nursing. Of course, the BSc nurse graduates with a degree, so he's ranked higher than a school of nursing graduate. If you graduate as a graduate nurse with a BSc, and you actually finished your internship of 1 year and you finished your NYSC. Remember, the internship is actually paid and it's quite hearty. The pay is quite hearty. So if you graduate with all those certificates, you get to be picked in the government as a SNO, something we call senior nursing officer, while a school of nursing graduates actually works as an NO if he or she is picked. So there is a lot of salary gap. So the graduate nurse is actually higher in terms of salary and in terms of certification and in terms of ranking on job options if the two of them graduate together. There is a known fallacy that university nurses actually don't know practical, that it's actually the schools of nursing that knows the nursing practicals more. This is me telling you that that's actually fallacy. Individual experiences or knowledge of clinical is dependent on the particular nurse and mostly the lecturers that taught the set or person, because most times even the lecturers are swapped from schools of nursing to the university, so it's usually most times the same lecturers that teach the schools of nursing that actually teach the universities. So that's actually a fallacy. If you're with me up to this extent and you think there is something I didn't say, or you have a comment or question, please leave a comment in the comment section, like this video, and do not forget to subscribe.